Are you confused about your health insurance plan? Do you wonder why you have to pay certain costs? A lot of people struggle to understand what their plans cover, what they have to pay, and how it all works together. You probably know that you and your employer, the state of Texas, pay for your healthcare costs. But who pays for what and when? We want to make your benefits understandable. Keep watching. In just a few minutes, you may be a lot less confused. All the health plans offered through ERS require cost sharing by participants. So, what is cost sharing and why is it essential? HealthSelect of Texas, the largest health plan offered through ERS, is a self-funded plan. That means all costs are covered by the state and plan members, not an insurance company. HealthSelect negotiates better prices with doctors, hospitals, and pharmacies to save you money every time you use a network or contracted provider. The state pays more than 3/4 of all healthcare costs. Plan participants pay the rest, usually through contributions, which are also called premiums, copays, and coinsurance. Because the state and the people in the plan share costs, both must pay more when costs go up. And health costs are going up all across the country. Cost sharing allows the state to continue offering high-quality coverage to employees, retirees, and their families, even as healthcare costs go up. Now, let's go over some of the ways costs are shared. We'll dig into terms that define your plan. ERS takes measures and cost containment strategies to minimize a cost shift to the participant. Let's start with the contribution or premium. It's the fee that comes out of your check each month to pay for health insurance coverage. Currently, the state pays the entire contribution for most eligible full-time employees and picks up part of the cost for eligible family members. Now let's look into copays. The copay is the amount you must pay for services like visiting your doctor or buying a prescription drug. Typically, it's a fixed amount that you pay up front at the doctor's office or the pharmacy when you get the service. The copay is usually only part of what the doctor, hospital, or pharmacy charges. Your health plan pays the rest. Deductibles. What's that? It's the amount a person owes for covered healthcare services or products before the plan begins to pay. For example, if a plan has a $500 deductible, it won't pay anything until the participant has paid $500 out of pocket for services provided through the plan. Currently, the ERS prescription drug programs have a $50 per person per year deductible. But there's no deductible for other health services unless you go out of network or out of area. It pays to stay in network. Some people confuse coinsurance and copays, but they're very different. Coinsurance is the amount you must pay for certain healthcare services covered by your plan, maybe a stay in the hospital or outpatient surgery. It's a percentage of the total amount owed for the service you receive. The plan pays the rest. If you have to pay coinsurance, you usually get a bill after you receive the service. Keep in mind, an explanation of benefits, referred to as an EOB, is not an actual bill. We hope you now have a better understanding of how cost sharing works and why we do it. Our job is to make it work for you by keeping costs as low as possible without compromising the quality of your coverage.